2.7 million service members have deployed to Iraq and Afghanistan in the last 15 years since 9/11. Of that number, approximately 6,000 have been killed and about 50,000 have been wounded with physical wounds. In addition, perhaps 400,000 have traumatic brain injury, and between a quarter and a third of those who have been deployed have post-traumatic stress disorder. So the physical wounds of war include lower leg and upper extremity amputations. They include genitourinary injuries, unfortunately in some cases the loss of the penis and the testes. And remember, the bomb is the signature weapon of the war, and the bomb has been taking out lower limbs and genitalia, and also causing burns in upper body extremities. So as you know, all of these could cause sexual problems. The medications that we use for post-traumatic stress disorder and traumatic brain injury also have a lot of sexual side effects. These sexual side effects, you can get through them if you know to ask about them, and then there's some strategies to alleviate sexual side effects. The most immediate concern if somebody's been physically wounded, usually for the physicians, is to save somebody's life. For the young service member, often a young male Marine or soldier, it's often, how's my junk? And then it's really important for the question of sexual health and functioning to be addressed early up front. And a lot of the time the doctors aren't doing that. They're thinking, well, we'll worry about that later. But if you're a young 22-year-old, that's one of your chief concerns. So the question about sexual intimacy, sexual health and functioning should be addressed all along the course of somebody's recovery. Unfortunately, there has only recently been a lot of conversation about the question of sexual functioning. There was a conference 2 years ago that the Bob Woodruff Foundation put on this topic. I thought it was a wonderful conference, but it was interesting because we've been talking about traumatic brain injury and post-traumatic stress disorder for years, but not about sexual health. So after that conference, I said, this is terrific. Somebody should write a book about it. And I got this deer in the headlights look. Well, my book on the subject is coming out from Oxford next fall, and then we put together a workshop here, which we gave on asking about sexual functioning and on strategies if there's problems. For example, if you have an amputation or another injury, you may need a little assistance to be able to have sexual relations. It might be a bar in the shower or using your wheelchair. A lot of it isn't rocket science, but it takes a willingness to address that question about how are you going to have intimate relationships. The specialized centers at Walter Reed and at Brooke are marvelous. They really are great. And there should be, and is in some cases, facilities at the Veterans Administration and local hospitals. And most of the severely wounded are taken care of in the Veterans Health Administration hospitals. But there's not enough knowledge. And then, of course, many of our veterans are going to be moving out into the civilian world, so they're going to be getting care through, for example, their college clinics or their work. And so, again, it's really important that at all levels, medical professionals, especially psychiatrists, ask about sexual health. Because we prescribe so many medications that have sexual side effects. The selective serotonin reuptake inhibitors, commonly used for PTSD, most estimates are between a third and a half of those cause sexual side effects. But if you ask an audience of clinicians what percentage of their patients on SSRIs have sexual side effects, it's 80%, 90%, all of them. So it's just critically important for the psychiatrist to be asking about sexual health and any sexual side effects, and warn your patient about sexual side effects before you put them on an SSRI. Otherwise, guess what? If they have problems with impotence, erectile dysfunction, they're not going to come back and tell you. They're just not coming back. It certainly has been an issue. It certainly wasn't talked about as much. But remember, we've got kind of a unique set of circumstances. The bomb being the signature weapon of the war, and now we have soldiers who are dressed in protective gear and Kevlar, many more soldiers are surviving with severe injuries. Routinely, if you go to, for example, Walter Reed National Medical Center, you see people shooting around in motorized armchairs, wheelchairs, with 2 arms, 3 extremities missing, and they may well have traumatic brain injury, they may well have PTSD. So you have a combination of injuries which you really didn't see in other wars. People died of those injuries. I want to have it be a very public conversation. I want medical students to be taught how to ask about sexual health. The occupational therapists, by the way, have been really a leader in this area. They consider sexual health to be one of the ADLs, activities of daily living. But it should be all medical professionals that know how and when, and not in an intrusive way. But what I do now is when I ask about depression and appetite and concentration and energy, one of my routines is sexual health. Another piece of it is we should be prepared to prescribe, for example, exercise, because so many of the medications we use cause weight gain, and if you've put on 50 pounds, you may not feel attractive to your partner, and she or he may not feel as attractive to you. So we need to warn patients and doctors about how do you get around the weight gain, as well as the other problems with impotence and lack of orgasms, lack of libido that comes with these medications.